Well, Intermountain Health, the sponsors of this segment, want to remind you about the risk factors of high blood pressure. Here's what you need to know.
Welcome to the Intermountain My Generation Maryland Parkway Clinic. And we're going to be talking about high blood pressure and why it's so important. Most people don't know they have high blood pressure until they come to the medical office. There are things that you cannot control, your genetics, your family history. But there are many things that we can control to help modify our blood pressure. One thing I always tell patients is you don't have to add salt to your food. In the United States, we use so many preservatives in our food, the main one being salt. You actually don't have to add additional salt to your food. And that's one way to lower your blood pressure. Another one is, how much are you smoking? How much are you smoking? Can you reduce your cigarette intake a day? That will help with blood pressure. How much are you actually drinking in terms of alcohol? Are you mixing both wine, beer, and hard spirits? Can we reduce the amount of alcohol that we're drinking in a day? Or how are you moving? Are you moving at all? How about let's walk 30 minutes a day with a friend? That can help reduce high blood pressure. While the number decrease is not important, the fact that it will decrease in general is what will happen. At the Maryland Parkway My Generation Senior Clinic, to manage my patients' high blood pressure, I often tell them to come in for regular blood pressure checks. We can do this as often as every 2 weeks to see if the medications are actively effective and working. We often do medication reviews. Are you actually taking the medication the way that it's supposed to be taken on a daily basis? We also talk about dietary changes that can be made. In addition, we have Intermountain Health classes where patients can actually learn about a hypertension diet. Patients are often asking me, Dr. Bradley, what gym should I go to? And I tell my patients, you don't have to go to the gym to lower your blood pressure. Something as simple as walking 30 minutes a day with a goal of losing even 2 pounds a week can lower patients' blood pressure between 5 to 10 points easily. And so I tell patients that the goal is how often they're using their physical activity, not necessarily the number of days that they're doing it. How often are you actually getting to 30 minutes of good physical activity will help lower your blood pressure. I often talk to my patients about a DASH diet. They'll say, Dr. Bradley, what is a DASH diet? What does DASH mean? It's a dietary approach to hypertension, to decrease the things that we're getting in our diet, eating more vegetables. Again, not adding any salt to the foods that you're already eating, decreasing our caffeine intake. Patients often say, I'm not doing anything to increase my blood pressure, but they're drinking 3 cups of coffee a day. Coffee can increase your blood pressure significantly. One of the things that I often discuss with patients is taking time for themselves. Focusing on what it actually is that they need, focusing on self-care is essential to decreasing one's blood pressure and finding things that you like to do that are enjoyable. Often when you're having fun, your blood pressure is at a lower level. So it's important to increase one's self-care in terms of blood pressure management.
Thank you to Intermountain Health for sponsoring this segment. For more information, you can head to intermountainNV.org. Las Vegas Now, we'll be right back.